All right, welcome back to Going All In, Get the Edge You Need to Succeed. We have a repeat guest with us today, Ms. Laura Mihova, who is currently well, I'll let you tell us where you're at.
Thank you for having me. I'm Laura Mihova. I am currently at University of Texas Health Science Center at Houston. I'm a second year dietetics student, and I'm also a master's of public health candidate.
Okay, so second year, we're finishing up in May of 23. So thinking about all that you've kind of accomplished so far, kind of run us through some of the rotations that you've had and kind of where you were located and some maybe highs and lows of each of those rotations.
Okay, yeah. So kind of how I mentioned that I'm doing my master's too. The way that my program is set up is that we do kind of an integrated approach. So instead of classes one semester and then rotations, I was taking classes during my rotations, right? As far as the classes were concerned, I was taking like community health classes. So my rotations were focused on community, and then I did both of my food service rotations. So I did Houston ISD, which was school food service, but interestingly enough, I wasn't really placed in the kitchens at the schools, which I actually super appreciated. A lot of my other friends who are at different school districts ended up in the kitchen every day, helping, ordering, that kind of stuff. But I was in a cubicle most of the time, and I was doing menu writing, which was super cool, and learning about how the USDA reimburses. And Houston ISD is kind of unique because they have the entire district is funded for free and reduced lunch, but it's for every student. So they met the eligibility criteria, I think in 2018. I think if it's over 50% of the district qualifies. So yeah, I think that was super awesome. But because of that, they had pretty stringent USDA compliance, right? So I was writing like 2 or 3 weeks out menus, and really just even as practice. I have no idea if they were ever implemented either, because we were doing a lot of turnover with our broadline distributors, and they had just decommissioned their warehouse. They actually had a warehouse on site that they were every single day would deliver to the schools. So that was really cool to see. It was a completely empty warehouse. But then on top of all of that, that was in January. So that was right when we started experiencing a lot of supply chain issues. So that was really interesting. That was my very first rotation ever. And it was something that I had never seen, like never even occurred to me that was a career path, if that makes sense. And I really enjoyed it, actually. Then after that, I had my hospital food service rotation, which was certainly it's not for everybody, right? They always tell us that in class. And I think actually getting to go see it in person, you understand why. So my preceptor, she was not only she wasn't the food service director, but food service manager. But she was also the clinical nutrition manager. So she oversaw not only all of the clinical dietitians, but 50 plus food service workers directly. Like they didn't have a manager or anything. It was, if you were to draw the hierarchy of physicians, like she was directly above probably 60 something people total. And I think that was really just the way that the hospital system worked. She was also employed by Aramark, not by the hospital. So that was stressful to see. I mean, that she was definitely wearing a lot of different hats. And because of that, I got a lot of experience there. But as far as the actual food service department was concerned, I worked a lot of tray line. And then my big project there was working in the diet clerk office. They didn't actually have any written documentation on how to train a diet clerk, like the people who answer the phones in the call center. So their protocol essentially was just shadow someone for 2 weeks and learn how they do it. So that was my big project there, was learning the rundown and then kind of drafting up the diet clerk orientation, just so that there was some sort of written protocol, right? It was definitely a potential liability. So, and then my community rotation was actually on site at school. So my school does we house a nonprofit called Nourish, and it is a community nutrition outreach initiative. Essentially, it's a seed to plate initiative. So we have an on-site garden, and then we also in the building have our kitchen. And two of my professors are licensed, or I don't know if it's licensed, but they went to culinary school. They have their whatever diploma from culinary school, so they're chef RDs, which is really awesome because they teach culinary medicine and really just how to get in touch with your food. The whole idea is, we're nutrition experts, but we should also know literally from seed to plate how that all works, and just the feasibility of, people think like, oh, farmers markets, fresh produce so expensive, that's, especially in Houston, there's a lot of limited access to that kind of thing. And so the goal of Nourish was to teach nutrition, but also to teach gardening skills and things like that. And that was a really fun rotation for me because we got to do the virtual lunch and learns, but also I got to tend to the garden pretty much exclusively. Like every single day I would go and I would do whatever needed to be done, but I learned a lot. And I actually now have my own garden in the front yard and it's doing very well. So I think it's something that we all need to learn how to do, in my opinion. And the teach a man to fish thing has somehow been forgotten, but it's like literally one of the best practices, I think, in dietetics.
What rotation are you currently in?
I'm actually not in a rotation right now. So this semester right now, we're just wrapping up. I actually finished my master's in December, but I'm going to graduate at the end. So we have a practicum class that we're enrolled in, and that's when we're doing our rotations for clinical rotations. So, but they want to refresh us on MMT because, like I said, last year was really public health nutrition focused, and biostats. I was taking biostats while I was in my hospital food service rotation, so I think that made things a lot more stressful for me. But yeah, so right now I'm not in a rotation. We do though have a simulation lab. We're the only dietetic internship with a simulator, and it's this medical. It looks like you're in a hospital, like an inpatient clinical setting, and we have a dummy that he has a microphone or a speaker, and the professors, it's a one-way mirror. So it looks like you're by yourself in this hospital room with the dummy. And essentially whatever we learn in MMT, that's our lab. So, 2 days later, we go in with a case study and we do our nutrition assessment and our nutrition-focused physical exam. So they're training us to have good bedside manner and kind of know what we're doing before they just stick us in a hospital, which I'm grateful for. I think that's a really cool opportunity.
So I know you're in an MPH program, and so it's kind of hard to compare that to a nutrition master's when you haven't done one yet, but your typical master's of nutrition is pretty much what you've already learned when you were here at LSU and kind of times it by 10 as far as the intensity goes. The patient scenarios are a lot more difficult to go through. Instead of learning the basics of community, it's how to actually apply it. So kind of thinking about that typical Masters of Science in Nutrition, how different are the classes that you're taking that are more for the MPH?
So that is the tricky thing with my program, is that because not all of them are like congruent with our DI competencies, to graduate with the MPH, there's completely different competencies that don't necessarily align. So I've taken epidemiology, biostats, like more of the math classes that you would, I imagine you would normally have to take those anyway if you're getting your master's. But then as far as public health is concerned, so we've taken a public policy class, we've taken Garden for Health, actually, which was not sponsored by Nourish, but because we have the on-site garden, we're learning about gardening, which is cool. And I'm currently taking, so my concentration in my master's is health promotion and behavioral science. So every semester I've taken a health promotion class, but it's either theories or, like right now I'm in an intervention mapping class. So essentially all of those classes, you choose a health behavior at the very beginning. And most of the time I stick to something nutrition related, but we did a gun violence one that was really interesting. But it's a lot of projects and it's a lot less, like clinical nutrition, like how you're saying, and way more on the community side where you are kind of hypothetically making an intervention or doing a community needs assessment. And it's a lot more hands-on and it's a lot more like application based, I guess. It's even if it's all hypothetical, you're still kind of from start to finish mapping out like an entire behavior change protocol.
And I think I mentioned this when I teach community. It's pretty much what you learn in a community nutrition class, except there's one class for theory, one class for intervention, one class for planning, one class for evaluation. Yeah, I'm seeing head shakes. It's pretty much that, so that you become an expert in those very specific areas, correct?
Mm-hmm. Yeah. Well, and it's actually really interesting to see too that a lot of, so at my school anyway, there's 6 campuses. So we have some professors who are in El Paso or Austin or wherever it might be, but a lot of my professors are also dietitians, and not necessarily teaching the nutrition classes. They're teaching public health nutrition or public policy or something like that. And the examples that they give in their lectures are really interesting because, the most immediate thing that you think of is SNAP and WIC and, school, after school snacks and things like that. But it is really interesting to see kind of how that stems off of the public health branch tree, because some of those same RD PhDs are also doing research on like Get to School Safe or the birthist data. Like they're developing the surveys and the questionnaires that go to just do more like census research in general. And it is really interesting to see that in practice.
I remember going through my PhD, you forget that something as simple as like seatbelts and like bike helmets. So it's all public health, and that might be someone's entire thing that they study.
Yeah.
So you look at something that's more like nutrition related and you're like, oh wow, I didn't think you could build a whole research career off of wearing your seatbelt or not wearing the seatbelt.
Well, and that's something that's interesting too, is the level of exposure that I've had to, I get an email every other day that's like, join us for this webinar. And, for the DI, you have to have a certain amount of professional hours, professional meetings. So they really encourage us to attend these webinars. And I was actually at a symposium and just, it was about physical activity. Besides the point, it was just interesting to see like the keynote speaker was talking about his main research project that he was there for, and then just started like showing all the other publications that came out of this one study that he did. And I realized, as a student, I'm really inclined to like, with all these different intervention health promotion classes, I want to learn something. So I'm doing lactation here, and then I'm doing kidney disease here. But ultimately, if you actually are doing research, it's so narrow, and it almost feels, I don't want to say like cheating, but I don't want for every single health promotion class to choose the same health problem, even though I probably would learn more in like a niche way. And like how, for you, like if you're doing research and doing publications, like they're all pretty like specific. And so it is interesting to just kind of like learn that that's how research works, you don't need to reinvent the wheel or start from scratch every single time, like how I would in a class or something.
So even though you're not quite finished yet, what is your outlook on what's going to happen after you graduate?
So, something that I've learned from one of my preceptors, and I know that this isn't always the case, but I know that it is important to have a clinical background of some sort for credibility's sake, I guess. I don't know if that's an old school of thought, but I've always wanted to be in community, truly. My experience at Nourish was really great, but I don't know how many other nonprofits exist like that. And I also know that that's probably not wise to do that right off the bat. So depending on how clinicals go, because it's not that I'm uninterested, it's just like, I just don't see myself doing that, but I might actually really enjoy it. It's just considering that I live in Houston and it's the biggest medical center in the world, the employment opportunities are really good here, especially for clinical. And I think it would be really good exposure because I don't know if I were to go clinical anywhere else that, I'd see the things that I'm seeing, like we have a NICU fellowship and things like that. So I'll probably just get my feet wet depending on how my clinical rotations go. But I imagine as far as like career path goes, like I'll probably do 2 or 3 years clinical and then branch off and do something more community based. What that is, I'm not entirely sure yet.
It's kind of funny because at one point you wanted to be a doctor. And the fact that you're like, clinicals, this makes me internally chuckle. But it does make sense, that conversation we had years ago when we were trying to figure out, okay, if you want to be a doctor, what do you want to do? And you're like, I really don't know. And it's like, well, then you don't want to be a doctor.
Right. Well, and it's funny too right now that, we get a case study for M&T and they give us all the labs and all the history and da, 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 da. And like sometimes the questions, they're not leading, but like they might throw you off. It's like define, it was like coagulopathy or something. And you're like, and then of course I'm doing a deep dive and trying to see what's the underlying etiology. But that wasn't the question. It just define coagulopathy. And then the rest of this case study had nothing to do with that at all whatsoever, right? And my scientist brain is over here trying to like read all the labs and figure it out, like before I even start answering questions. So I was telling my friends, I was like, I feel like I would have liked med school or like liked being a doctor, but I like talking to people too much to be a doctor, I think, and same thing with like nursing or something. It's like, I feel like I could have been a good nurse, but truly like the time that you spend talking to someone as a dietitian, and you're still problem solving. So I think that's great. But I do think that this is probably the most unique field in that way, that you're like still science, evidence-based, and you're coming at it from a more behavioral approach. So it's perfect balance for me, I think.
And I feel like case studies are always that necessary evil in training so that we can put you through the problem solving. But it is really like when you get into the hospital and you get that patient and you're in the health record looking through everything before you even talk to them, you're trying to figure out what's wrong. Yeah. So almost to like prove yourself right when you walk in the room. So you ask the right questions. And then depending on how they answer, pretty good chance you were right before you walked in. Now you just have proof that you can jot down in the chart. But a lot of times it's going in and wanting to talk is good, but you're still going to do your homework on the back end, but you're not going to sit there and go, what's this mean? You're just going to Google it on your phone real quick.
Right.
Oh, that's what that means. Oh, that makes more sense. And it's like, it's so different when you actually like get into it and you're like, oh, this isn't as bad as I thought it was going to be. It's like, no, because case studies are awful.
Case studies are horrible. And so something that like, as soon as I said it, it was on the first day of our simulation lab. And I was like, the first words that came out of my mouth when I raised my hand was like, I know I shouldn't say this in front of everybody else. I'm so sorry. But so, we're all perfectionists. All dietitians are like, so type A, so perfectionist, blah, blah, blah. And they sent us our case study like the morning of or something, or like super late the night before. And I raised my hand and I was like, honestly, I'm kind of glad that you guys didn't give us time to like research and obsess over it and just like come in with our head straight on our shoulders, like, and just look at it and then go approach it however you're going to approach it. Because like, yeah, again, we're all perfectionists, and in real life, like, you don't really get 2 days before to research one patient. Like, you're going to be seeing multiple patients every single day. So I said, realistically, you know, I'm grateful for this, but don't tell anybody else I said that, because the turnaround time, because we still have like the entire other rest of the questions on the case study, and they give us like 24 hours to turn it in. So it's intense.
So speaking of perfectionism, the other interns in your class, how have the personalities of the other folks in your class like helped or hindered any of your experience?
So I definitely think at the very beginning, it was a lot of, imposter syndrome, but also, it is hard not to compare yourself to like what is, it's all new. And I will say that like the master's thing, I think no matter what, no matter who you are, how smart you are, it is like just a learning curve. And I've found it really helpful not to base like my study plan on how other people are approaching it, just because like I'm pretty secure in the way that I get things done, but it is like difficult to not like, when you're comparing yourself to like, oh, the person who's doing homework already for 3 weeks from now kind of thing, you're like, why did I not, am I? And so I realized that it's just not, you can talk about school, but a lot of the time if we hang out outside of school, that's like my role. Every time we come over to my house, I'm like, we can't talk about school right now. Because sometimes it just leads to more confusion, really. But it is nice because at this point, nobody's competing with each other. And I think we bring a lot of different things to the table. I think a lot of us have very different interests career-wise. Like some of us want to go to culinary school after this is over. And one of my friends wants to be a doctor. Like she's applying to medical school in the process right now, which is nuts. And then this person's clinical and this person has no idea what's going on. And it is refreshing to see that like your path is your path, like, and everybody's very supportive of it. So.
All right. So going way back, and I know we talked about this in your previous episode, but you had applied to UT through pre-select. Mm-hmm. So hindsight, was it worth it, or could you have been okay just going through the process of trying to match? So
in my head, so what's kind of interesting about pre-select, right, is that even though you hear early, it's like the application timeline is kind of the same. So although I think really what with diecast that I was like just not into was the idea of not knowing where you might end up, like you get your second choice or something like that. So I wanted to give it a shot. I was still planning, if I hadn't heard back after pre-select, I was still planning on applying the normal route. But yeah, I thought in my head that it would, ease my anxiety. And as it turns out, like I think my application was due December 1st, and I didn't hear back until probably mid to late January. So that's very similar as like when you hit submit on diecast, like you're not hearing back until April. And the tricky thing too, that was almost more anxiety inducing, was that I was like, well, I need to know soon so I can figure out if I need to take my GRE or not or whatever. And it was actually the day before I took my GRE, I got the email that I was accepted. And then I didn't even take my GRE. I was like, I'm done with all, like, this is where I'm going. And so it was really nice to like have the option to just only apply to one school and then decide that this is where I'm going.
Did you have any like thoughts? Because through that semester, you're listening to everybody else talk about die cast and match. At any point where you're like, maybe I should have waited and maybe tried somewhere else? Or
honestly, no, because it was my number one. I think especially, even though my class is grandfathered into the eligibility without the master's, I just knew like the competitive advantage of having a master's. And I wanted an MPH because at LSU, I worked at the health center in health promotion, and pretty much everybody in that department had an MPH. My sister had an MS at the time. I just wasn't really that interested in writing a thesis. So UT was always my number one, because the only other similar program I think is Tulane, but I wanted to see if I could get in-state tuition, because, you know, that definitely makes a difference. And then all of the Texas schools are all MS. So, you know, I think I would have had a good time at any of the schools I went to, but definitely, yeah, I don't regret not going through the traditional process at all.
is the length of the program bothering you at all? Because 2 years seems long.
Well, it is long, and well, it's going by very fast. I will say that. But like I said, you know, we're meeting master's competencies while we're meeting our DI competencies. So they've set us up in a way that the master's practicum, it's typically a 3-hour class, but they've split it into 3 1-hour courses so that we can have rotations more than once, because to meet the 1,000-hour requirement, right, there's no way that we could do that in one semester. But because of that, you know, I've been enrolled in like 15 credit hours, which is a lot. Like, that's like grad school credit hours. I think in undergrad, that's like a pretty decent load, but in grad school, it's like, ooh. And nonstop either. Like I had winter break, but then we had to get in our like peds workshop for the DI. So they took our spring break. And then I had like 1 week, and then summer classes started or something like that. And so it's always, and I had a full summer, but then once there was supposed to be a break, then I'm doing like my diabetes seminar workshop thing. So it's always something, and it's kind of nonstop, but I think that's why it's going by so quickly. And honestly, I'd rather have a lot to do and then just get it over with than, you know, maybe just do my DI and then think about getting my master's and then not follow through from being burnt out or something. So it's finally slowing down. I'm only taking 2 classes this semester, so it's much better. And then next semester I don't take any classes. So
all right. So what were some of the things that you've been learning in your rotations outside of the typical competencies that we're all supposed to master?
I think it's really interesting in general, like the graduate student like mindset, I guess, because you're moving from like a very concrete like way of thinking from undergrad, you know, this is the answer, A or B kind of thing. And then you go out and you're in practice, and there's not necessarily a clear-cut answer a lot of the time. And, you know, I think it's just kind of the acceptance of your reality. It is really difficult, I think, and I speak for probably everybody to recognize, you know, that sometimes there's just not an answer, right? And as a student, it's even more confusing because, right, like you're there to learn, and you really need to feel supported. And sometimes like that's just not the case. And luckily I didn't have any preceptors who I butted heads with or anything like that. But I think just generally like the environment that we were all in, you know, at my hospital food service, where it was really stressful environment. And my boss was like, I can't do all of this work. And she was so stressed out. And you're thinking like, there has to be a reason why. And there's sometimes just not. And then she also taught me that, going off the perfectionist thing, is that, you know, she's also a dietitian, so she's a perfectionist. And I think a lot of us, especially in undergrad, tend to go like above and beyond and perfectionist cherry on top, like do far more than was ever expected of you, right? But what I learned there is that in some cases, like just even completing the task is a win. And sometimes you can't even complete the task. And so, kind of, I don't want to say lowering your standards, but not holding yourself up to that, just like, I have to exceed expectations, because sometimes, yeah, the expectation is that you get close to finishing, and then exceeding that expectation is, okay, I was able to do it. And sometimes you're not even able to do it. So it was a little disheartening to think that that's the reality of like that particular situation. But, it was refreshing to know that you don't have to hold yourself up to that, just, and we're still learning. I'm still learning that, but you're going to work yourself into the ground, truly, if you expect that of yourself. Just not reasonable, I don't think.
So what are some of the things you were mentioning about some of your rotations that your preceptors were teaching you things more on the management side with people?
Yeah. So I have two good examples. So at my school food service, this is the nutrition department, but only half of it was food service and the other half was quality control and, the ordering, and just facility operations. And I realized that, these are separate departments, even though umbrella term, like we're all in the same building. And priorities were definitely different, because I sat in on a meeting about like if the freezer at school is down, because they just implemented a new system. So you can see, and it's the weekend and no one's there, and who has the keys, and you have to call this person, and then 14 other people have to show up. And they were trying to figure out if, from like a cost perspective, if it made any sense, like how much food would end up going to waste, do we have to throw it away, versus how many people's weekend do we have to disrupt, which of course, like I was not supportive of that excuse. But then realizing like, okay, there's, from the dietetics side of things, there was only so much leverage, I guess, that we had, because they were, again, like equal on the management scale. So it was really interesting to like think of how political organizations can be. And in the same way, like I was saying about my hospital food service, so my preceptor, one of her responsibilities was hiring, but they had a recruiter, but at the hospital, say same skills and same pay as if you were to work at McDonald's or something. But if I go interview there, this is to work food service, right? If I were to interview there, I could get the job for tomorrow. But at the hospital, like there's all of the background checks and clearance that you need to work in a hospital or deliver the food or something like that. So people, I think the hiring timeline was 3 months or something like that. And then on top of that, when she first got hired, she was in a hiring blackout. So just learning about the management side of things, like she was responsible for this understaffed kitchen, but she wasn't able to, restaff it because she's on a blackout. And then even if she were to hire a bunch of people, they wouldn't be able to start working for another 2 or 3 months. So it was really crazy to experience, that you don't really think that you're going to be managing the whole kitchen as a dietitian, or at least as a dietitian manager, you'd think that it's just the clinical dietitians or something like that. So that was pretty eye-opening experience for me. I was like, whoa.
So have there been any lows that you wish like situations you wish had gone differently?
I think just from the administration standpoint, like at school, there definitely was kind of a lack of communication, or not lack of communication, but I think things weren't being communicated very effectively for us. And we recently had an overhaul on like our faculty, like that's a huge mess. But in the past, you know, like how I say that feeling of confusion. And so I think not like specifically, but just generally feeling like not as informed as I should be about just how things are going or what to expect or things like that. I think, yeah, I just kind of wish that that was something, but from what I understand, that's not really an isolated event. And most people who are planning on entering higher ed, I think that should be kind of the expectation. Again, like the concrete, like, what do I do? Can you tell me? And they're like, oh. So there was a lot of confusion going into it. And I just like fully was not expecting that. I was expecting for someone to hold my hand and guide me through the process.
So the truth reveals itself.
Mm-hmm.
You wish, I mean, that's a good point, because not that we hold your hand at the undergrad level, but we definitely make sure you know what's going on at all times.
Oh yeah, absolutely. And just feeling really supported, especially, you know, towards like in my upperclassmen classes, you know, as a senior, like, and when I was taking your professionalism class, like really feeling prepared for what is to come as far as, you know, the next few months anyway. But I don't know, there should have been like a workshop on what now you're in your program, here's what to expect now, because it's totally different. And, you know, I always excelled academically, but just like, I think from an organizational standpoint, like there's really nothing, you can be as smart as, you know, your IQ could be whatever it is, and that doesn't matter. It really is like a communication thing. So learning to respect good communication for sure.
All right. Is there anything else that you want to share with the viewers about your experience?
Well, I mean, if anybody has ever gardened before or is interested in learning, I think that's definitely worth a shot. I don't want to sound like cliche and all like garden girl or something, or you know, be promoting my program too much, but definitely it's been something that's very like from a mental health standpoint, like it's really nice to go outside and nurture something and like really see the progress there. And then I get to feed myself too. And it's really, really exciting. So I've gotten super into it. And I think it is worth exploring. Like if somebody has an interest in dietetics at all, like it is cool to understand like where your food comes from. So definitely look into that, I think. And as far as words of wisdom, you know, good luck. Truly. I think the DI is definitely worth it, and definitely something that you have to kind of go through. It's like the hardest part of becoming a dietitian. And then after that, as far as I understand, it's smooth sailing. So get through it and then you're good.
All right, perfect. Yay. Thanks for joining Laura and I on this episode of Going All In, Get the Edge You Need to Succeed. Don't forget to like and subscribe so you never miss a new episode. And we have plenty of those coming up for the remainder of 2022. And we'll see you next time. Bye.